And we are live.
All right, great. Good morning, everyone. I want to welcome you to our Health and Wellness Advisory Committee meeting for Wednesday, September 6, 2023. I hope everybody had a great Labor Day weekend. Hopefully everybody got a little relaxation and some recreation in maybe. And I know it's a short week because a lot of people had Monday off. So I appreciate your time and jumping on here, because I know that sometimes when you condense a 5-day weekend to 4 days, it makes more work for us. So I appreciate you taking the time to be on here for our Health and Wellness Committee meeting this morning. If I could, Paul had sent out minutes from our August 2nd, 2023 meeting. Can I get an approval to, or a motion to approve those minutes, please?
I'll make a motion.
All right.
I'll second.
Okay, thank you very much. We have a motion to approve and a second. Any discussion on that? Any deletions, any additions? If not, all in favor, please say aye. Aye.
Aye.
Any opposed? Okay, the minutes are approved. Thank you very much. I'm going to call on Paul Wieters, to talk to us a little bit about access to care. He's going to share his screen as well before we move on to agenda item number 3.
Thank you, Kevin. I just wanted to, we had access to care listed on our agenda today, and back in early in the spring, when we had the discussion of the 2022 Community Health Needs Assessment that the Charleston and Roper and MUSC had completed in late last year. Access to care continues to be the number one health priority in our community. And in their handout that they gave, one of the issues that was brought up was transportation, and just being able to get into transportation was a barrier, especially for those out in rural areas. Charleston, like Moncks Corner, there's no public transportation. Even in Dorchester County, the bus does not come throughout Somerville. Transportation has always been an issue in the Tri-County. And in that discussion, it had come to in our general conversations from Joey Current with Trident United Wage and Mike, we really just realized how much Carter plays such a key, valuable role in transportation to help us with access to care. So we reached out, and Mike volunteered Carter to do one of our meetings, and we held it off to the September time. So it's at this time that Kevin, I turn it back to you, but we welcome Carter to just help us connect the dots and learn more about how we can also connect the dots in our community through what we know about Carter.
Great, thank you, Paul. Appreciate that. And with us this morning is Michelle Emerson. She's the Marketing Communications Manager for the Berkeley Charleston Dorchester Council of Governments, and we're happy to have her here to tell us a little bit about CARTA and access to care. So if you would, Michelle, thank you.
Absolutely. And thank you guys for having us. We always welcome the opportunity to talk about some of the various programs that CARTA provides in general to help various members of our community, our residents throughout the year. So again, thank you guys for having us. And I see we have Chairman Seekings on. So please, if I forget anything, I'm sure that he can kind of follow up and add anything else onto it. So give me 1 second. I believe, Paul, you said the share is on.
Yes.
So let's see if I can.
You get it?
Okay. Okay. Are you guys able to see the majority of my screen? Okay.
Yes, ma'am, we have it.
Very good. Sorry about that pop up in the bottom. I can't seem to get rid of. I got to reboot my computer. So, but wanted to go ahead and get going for you guys because I know you've got a full agenda. So again, just wanted to talk to you guys just a few minutes about how CARTA is connecting our communities. And we believe that, you know, health and food access both play kind of hand in hand. Having access to healthy food options is just as important as having, you know, a ride to the doctor or for follow-up care at various health institutions as more of a preventative measure. So I just put a few bits of information in there on both items just to kind of give you again a understanding of some of the programs that we actually have here. So it's important to know that many of CARTA's regular routes do run to most area stores, but they also run to most healthcare providers as well. They run, of course, in the downtown area, but we also connect to other areas, Mount Pleasant and West Ashley, all of the routes as it is. Let's see, minimize this. Are you guys able to see both sides where it says fares on one side as well?
Yes.
Okay, perfect. A couple of years ago, I believe it was during COVID, we actually modified our fare structure to, excuse me, to allow for people to have varying options to pay for passes because we listened to the community and they told us that sometimes buying those larger passes are just out of the frame of what they can afford on a regular basis. So again, our executive leadership and our board was wise to change some of the things, the passes that we actually offer. And so we went from just offering things like 3-day passes and 31-day passes to actually offering 7-day passes. And I'll talk about how all of that kind of rounds out into making sure that we have access to, again, to various stores, but also to healthcare. Low income fares are available for those vulnerable in our community. There is a small process that has to go about, but all of these things are hopefully put in place to help people be able to have access without it being too much of a strain on their everyday income and what they have to do on a regular basis. During that time, our senior fare was also modified to make it $1 all day. We had been hearing about that for a while, that we have very active seniors. And so just being in non-peak hours was not good enough. We needed to make sure that, again, they had the ability to get on and move around, whether it be work, whether it be healthcare or access to food at any point in time. So all of those things kind of helped in that area. Just again, touching on the food portion of it, again, prior to COVID, probably when BILO actually did not continue to have their operations in the downtown area. Again, our executive team and our board was wise enough to allow Route 20 to operate for free. And that has been a huge help to all of the citizens in the downtown area. These problems sometimes present opportunities to help our fellow citizens. So we modified it and became fare free. And it is important to remember that when that did occur, various businesses came together as a partnership to pay for that route initially. After that, again, we heard that it was such a big need that the board did vote to continue that. And so even as of right now, that route is still free and it allows that access to that Food Lion. And it also has access to the pharmacy, which we heard a lot of people that in the area and in the community, they actually are able to, again, more easily get their prescriptions and stay in a healthy way. We also have dash routes that, of course, operate free in the downtown area. And we also have a new program that offers additional connections that I'll talk on in just a second. Telluride, just wanted to touch on this for a second. This is our service, our paratransit service. It's important to mention this because this is one of the main things that we promote as far as for Telluride. This is for folks that are in our community in the Charleston area to access if they have a disability. And so it is a small, again, it's an application process, but a lot of times seniors fall into this, but it's not just for seniors. And I always like to point that out because unfortunately, sometimes people get into the thought process that it is just for seniors. It's just that seniors happen to usually qualify because they usually have some type of disability, or they may not have the functionality to be able to, say, stand in a bus stop for a long period of time or walk for long points to point. And so a lot of times seniors do qualify for that, but that is a curb to curb service, and it runs throughout the Carter service area, throughout the downtown area. And so that again allows all of those folks to be able to get reoccurring health care as need be. It's also important to note that if any of the customers that are approved for Teleride, they actually are able to ride our regular routes for absolutely free. That was done because we know that, again, sometimes people have better days than others. I always use my mom as a great example. Sometimes she has great days and she's able to walk to the park, and then there's other days that she can barely get around her house. And so having that ability to, when they are feeling a little bit better or they are able to use the regular service, that also helps, again, with their budget concerns. Now, talking about some of the newer programs that we have, Carter On Demand. This was started a couple of years ago. I think we're in the second year right now. And the primary reason for this program starting was because of healthcare, and making sure, I believe that when we talked to several healthcare providers, they informed us of the high percentages of people who were unable to stay in a healthy regimen because they weren't doing follow-up care. They may make it to the doctor the first time, but the second and third time, they're not able to continue that. And we've heard that continuously from folks at MUSC, for example. And so Card On Demand was originally put together basically for that. We wanted to make sure that those who needed connections to healthcare and repeated connections to healthcare, that they had it. This is a partnership where we partnered with Uber and Lyft to provide on-demand service, just like a regular Uber service. We partially subsidize it. And this is for current Teleride customers, but the unique thing is that it's also for seniors 55 plus. Again, many of those seniors have some type of inability to be able to do just regular things as far as distance and endurance per se. It's been a really great partnership thus far, and it runs Monday through Friday. It started out as a pilot program, primarily in the Peninsula area, and it is then thus actually expanded to the entire Carter service area. It is available Monday through Friday, and there is a short application for seniors. Our current Teleride customers are automatically able to use it. They just would have to contact us so that we would send them a voucher. But it basically works the same way as you would order a regular Uber. The customer pays the first $4, and we subsidize $21. So it's up to $25. Anything over that, then the customer normally pays for. With Teleride, they're actually covered. And I can answer any questions on that. But this has been a great program, and we're really happy that we're able to continue this. And again, it has been a great help for these folks being able to get to healthcare that they need and the repeated patterns. Finally, one of the last things I wanted to touch on is, again, touching back on the food access program, because again, we realized that access to healthy food prevents many things. And so BCDCOG and Carter partnered with a few community organizations, and we introduced healthy food, fresh food to go. This was a pilot program where we had some of our folks actually do a survey asking some of our riders, what was hindering them from getting to healthcare and to healthy access to food. And so we tried an experiment with some coolers that were on some of the buses, and that was warmly received. But what was even more, the riders were more excited about, is that we also presented with insulated bags. We presented them with some insulated bags and with larger tote bags. Now, what that means is Carter has a rule where you can only carry about 4 bags on a bus, and that's primarily to make sure, for safety reasons, that people can control what they have. But those larger bags allow them to carry more items, meaning less trips to the store, again, improving what they're doing on a preventative side. And so that has been very well received, and we're hoping to be able to continue to find grant programs like that to do those types of things for the community. Lastly, just wanted to talk about the fact that we are continuing to look at different ways that we can improve our system, make it work more efficiently. And currently we are doing the downtown Charleston transit study. We recently had an open house in the downtown area, but basically this project is looking at all of the transit routes and, again, making sure that they're working as effectively as possible, where they could be working a little bit better, including making sure that they are good connections to our healthcare providers throughout the peninsula and throughout the Charleston and the Carter and Charleston area. And with that, hopefully got to just about everything, but I'd be happy to take any questions.
Thank you, Ms. Emerson. Any questions? I've got a couple if nobody else does. Just on the
I have a quick question.
oh, go ahead, Carolyn,
It's
please.
Carolyn on the phone. Very quickly, the application process is because some people don't have access to online services. Is there a way that people can easily access applications? What about people who don't use computers often?
Yes, we do have access. We do have paper forms that are available. We quite often work with our providers to provide them with one copy if they need to make multiple copies. But we also have customers that call in and they need it to be mailed to them, and we do that as well. It is about a 10-page questionnaire, and they do have to take it to their healthcare providers to get it signed off on. But we will provide that when they need it.
Ms. Emerson, do you know that number?
Thank you.
Do you know that number that they would call?
They could just call our regular number, the 843-724-7420, and they can just ask for a copy to be sent to them.
Okay, great.
And I can also provide my direct email address if necessary so that they can get to me if they need that as well.
Very good. Do you, the cart on demand, do you see that taking the place of Teleride, or is it, you think it's just going to be something in addition to Teleride?
We believe it's going to be in addition to. Again, currently Carta on Demand is Monday through Friday, and it is 7 a.m. to 5 p.m. And so even with or without those types of restrictions, we still see it as being a need that both will be working hand in hand. And there's also, it's to mention the fact that our Teleride customers or our Teleride drivers provide a little more access as well. They can help people on and off the bus that may need a little bit of additional assistance with getting on or getting to their location. They can't go inside. And that's not necessarily something that's always offered by Uber. I know that they can open doors and things of that nature, but sometimes they need a little bit more care. If they have larger accessibility items that they're using, i.e. wheelchairs, things of that nature, that's where Teleride comes into place. So I see it as being truly hand in hand.
Okay, great. And I do see Joey Current has a clarifying question on here. Does curb to curb mean the route picks up passengers at their home and drops them off in front of their destination, or is it another set route? No.
That curb to curb does mean that they pick them up at their location and they take them to the actual location. Again, we just don't necessarily, the term isn't per se door to door anymore. It's just curb to curb at that point. Because again, it sometimes can give people the perception that they may be able to help someone into a facility, things of that nature, when they really can basically just help them to the door, and then someone from the facility can take them at that point in time if they need that assistance.
Okay, great. And I do see that Carter Chairman and Councilman Mike Seekings wants to say a few words, if you would, please.
So thank you, Mr. Chairman. And Michelle, thank you for coming to this morning and explaining what we're doing. For those of you who don't know, I've been the chairman of CARTA now for 8 years. I sat on the board for 14. CARTA, by the way, is a creation of the state legislature. We exist through a state statute that was born of SCE&G not wanting to do this anymore. And so our board is made up of 18 elected or people appointed by elected officials, and we are committed to access to the community assets, and food and healthcare have been really on our minds for a good while now. Any suggestions that you all out there have in the community to how we can better the service, we're all ears. We do believe the programs that Michelle has told you about this morning have been very successful, particularly CARTA on Demand. And we've got a pretty good sized budget for that. So please let any peoples that you come in contact with and know that that program is out there. It's popular internally. We'd love to expand it. So the demand side of it will sort of push us in that direction. And as you heard, it's limited in its hours. So anyway, CARTA's come a long way. We know we still got a long way to go, but with other things happening, the expansion of service, Low Country Rapid Transit, the expansion of this community and the number of people here, our ridership's growing. CARTA is going to be an integral part of who and what we are here in the Charleston area, and more important than providing access to community assets, food and healthcare at the top, and we will continue on that path. So thanks, Michelle, for your team. I see Paul says it's CARTA in all 3 counties. We're not with the Charleston Area Regional Transportation Authority, but we do operate in conjunction and cooperation with Tri-County Link. I think that you will see somewhere in the not too distant future a push to merge the two. So we do truly have a tri-county transit system. We're just not there yet. So again, Michelle, thank you.
Thank you, Councilman Seekings. I get
Thank you
Real
so
brief.
much. I appreciate it.
Thank you, guys.
Yeah, thank you. And I just wanted to ask too, Mike, where are we exactly on the Low Country Rapid Transit, and what additions is that going to do for access to care, I guess?
Well, for those of you who don't know about Low Country Rapid Transit, I'll be very brief, although there's a lot to say about it. It's the first ever large scale transit project, not just in this region, but in the state of South Carolina. It's a mostly dedicated line that's going to run from just south of Somerville to the medical district and the west edge, about 21 miles, linear. It will be rubberized. It'll be at grade, so it'll look like it's light rail, but it'll be rubberized. And it's going to be transformative for a number of different reasons. It's going to produce a transportation spine through the community. It also will aid in, we believe, and we've spent a lot of time looking at it, the development of live, work, play nodes in that corridor. It comes down the Rivers Avenue corridor into the Upper Peninsula, down Meeting Street, it says King Street, sorry. So it will be transformative. It also is something that we're looking at to add and to make the roads in this community safer. Perfect example, Rivers Avenue. On Rivers Avenue, you can go a mile or more without finding a crosswalk across Rivers Avenue. All this project will actually address that, make it so much safer. So where we are, Councilman, is we are in the design phase of it now. You may have read that Secretary Buttigieg was here now about 6 or 7 months ago to sort of see what was going on. The project is funded through a 50% county half-cent sales tax contribution. The rest is coming from federal grants. After the secretary was here, they actually upped our budget on the federal side, in the Federal Register, by another $100 million. So once we get designed, get the very small amount of land acquisition we have to do, construction will begin, and we should be up and running. And we're not going to open it in segments. It's going to be opened up as one project on one day. We should be up and running in mid to late 2028. So it seems like a long way down the road, but it really isn't quite as far as you might think.
Very good. Thank you.
$750 million project plus or minus that's funded, which is rare this day and age.
Very good. Thank you for that update. Appreciate it.
Sure.
Thank you. All right. Well, any other questions on access to care? CARTA questions?
Joey has his hand up.
Oh, I'm sorry, Joey.
It's okay. Just a real quick question. You mentioned that the Telluride service is a large qualifier for a lot of other services, right? If you qualify for Telluride, you get the other routes for free. You get CARTA on demand. And you mentioned that it is to serve vulnerable and underserved folks. Can you just describe in a little more detail what the qualifications are for that Telluride service?
Michelle, are you still there?
Yep, I'm still here. Sorry if my video isn't coming across. But as long as you guys can hear me, that's good. Absolutely. So there are various qualifying questions that most public transit systems use around the country. And they basically are asking, again, people's ability or inability to do certain things, i.e. meaning to say stand at a bus stop, unsheltered bus stop for more than 5 minutes. Are you able to walk a certain distance? What's the longest you can walk? A block, half a block? Those types of questions are what's asked. If there is a actual disability, what that disability entails. And then a doctor actually reviews it, and they will also submit something on that application describing the person's mobility, any mobility issues or their disability, and then they sign off on it, and then we review it and go from there. So that is a little bit more detailed. And again, it does take a little time to make sure you go through it and make sure you answer every single question. And for the review process, it's not that long, it's just a few more pages. Now with, again, Card on Demand, Telluride is already in that. Seniors are the only ones that do an application, and even that's a very quick application. Is basically just verifying their information, and then we need a verification of age. I believe that's we do have a lower fare for those who have, I would say, more minor disabilities, and that's something that they can qualify as well for. And that's more of a short form. It may just be a page, but that is handled at SC Works off of Hanahan Road. They handle our low income verification, and they also handle that portion of the disability. But again, that disability option is more for just our regular route service, and it provides at a discount for those who may be having a temporary disability. But again, it's a multi-questioned application, and it is on our website.
Thank you. I think Nick Osborne has a question.
Yeah, no, thanks very much indeed. And Michelle, thanks very much indeed for the overview. Just a quick question. Is there anywhere where there is some very summarized information available that, I mean, I'm thinking about it specifically from our perspective at the food bank, that we can share with our partners and with our neighbors as well? Those that are coming to our facility, we often give out lots of information as to where our neighbors can access services. So I'm just wondering whether what you've presented is summarized in any form, in a short form that we can use to socialize and share with our neighbors, because there's some really wonderful information and wonderful opportunities. And we're certainly seeing in a lot of the work that we're doing that the issue of transportation comes up time and time again, and lack of access to it. So if there was anything available that we could share, that would be really helpful for us and would great for our neighbors as well.
Absolutely, absolutely. We do have a few items that we quite often take out to the community on the varying programs. But we can also look into putting something together, kind of combining it so that it's a one-stop shop that you might be able to just kind of have some places and have them posted places. We can put that together with the various options of what we just talked about for those who are vulnerable or at risk in our communities, you know, Telluride, where they can go to find more information about that, the basics about that, and then of course, Card on Demand and a few other services that are free in the downtown area. We can kind of combine it and make it a little bit more simplified instead of the 2 or 3 flyers that we normally take out to, like, you know, community events and fresh farm market type places.
Ms. Chow, when you do that, where will that be that we could access it to either share our neighborhoods or put on our website somewhere?
Sure. I can make sure that I get it to whoever in your group would like that. I can also make sure that it is posted online in our various, like on our Telluride page, as well as our Card on Demand page. We can probably put a little link there that says, you know, for a summary of this information, and click on that. But I can, again, send a PDF to you guys, and you guys can distribute it throughout the group. And I can always send it through Chairman Seekings as well.
Yeah, if you could send it to me, I'll be glad to pass it to everybody in this group, and Mike can add in if he needs to.
Yeah, I mean, we've got plenty of information, and sometimes, you know, with any transportation system, one of the things that's a barrier to people using it is not their ability to use it. It's their sort of, not fear of it, but not understanding it, not understanding all the things that you can do with it and how simple it is. So anything that we can provide to you all, and you can then pass on to your clients, customers, we're happy to do it.
Absolutely.
It's pretty simple system. We just switched service providers, and we're working really hard with them to really make the process, the actual act of riding the bus, as simple and as friendly as possible. And we're getting better at it. So come on.
Yep.
Well, Ms. Emerson, thank you so much for spending some time with us and telling us about these programs. And, you know, we really appreciate all the work you do. And of course, all the work that Councilman Mike Seekings does as well. So Thank you.
One other thing, Kevin, we did it last year. We're going to do it again, and we'll give you advance warning on this. We did no pay May last year, and the ridership on our system almost doubled. And we suspect that it will do it again with our new provider, with our new services, with our new sort of marketing campaign. I suspect you'll see another event like that late this year or early next year, and we'll keep you all involved because it's a great way to learn the system for free. We did it for the entire month, and like I said, it was wildly popular.
Good. All right. If there's nothing else there, I'm going
Thanks.
to move on. Yeah, thank you very much. Appreciate both of you, Ms. Emerson and Mike Seekings. Appreciate all your work on this and for presenting to us today. Thank you so much. And we'll move on to our next item, which I know Mayor Tecklenburg is very much in favor of working with the White House challenge to end hunger and build healthy communities. Of course, we have Nick on here, but I want to call on Paul Wieters to tell us a little bit about that first. Thanks,
Kevin. I sent this little information out to you just so that I could try to sort of briefly explain it, but it's a challenge that is really looking at, it's a lot of the focus on our children and making sure our children are fed, but it's looking at improving accessibility. Most of the in the handout, most of the items were state government, but there were some that came down to the locals that I thought we could look at just to whether we could support them and recommend them to city council. And that is, can we work with trying to identify, creating a plan to end hunger and reduce diet-related diseases in our community that we could encourage. And I think that's just simple of us pulling people together to have that conversation to help out with our local food bank, et cetera, to do. The other one was looking at, again, there's things that can be done at the state level, but if we could look at it creating, and you know, again, this is something that Nick and them have been working on, but creating food and farm advisory councils or committees to try to help out, that we can try to connect farms to consumer markets and access to healthy foods. All of this is just areas where it's common sense items, but it is an initiative to try to bring the attention to that local governments can do more to try to help address the hunger issue. The mayor recently signed on, and it also talks about physical activity, and a lot of these things you'll see that the city is working on, but there are other items that there are items that we can do with the school district or promotion or making more visibility to do. But anyways, the question is can we get involved and to pass it on? And with that, I want to jump over to another quick slide of when this first came up, we reached out to the mayor. The mayor was invited to be a part of a mayor's initiative to do y'all see that screen? Okay. The Mayor's Alliance is in partnership with the Share Our Strength No Kid Hungry campaign. And I put a note under here, and I'm going to let Nick take it from here, but I'm just going to say that as of August 29th, there are 287 members of the Mayor's Alliance from all 50 states in Washington. And Nick, when the mayor was looking at this, Nick prepared a couple of documents to, I'm sorry, I got the wrong slide up, but he prepared a couple of documents to tell the mayor what we were doing locally. And I think that's the important part. And that's what I want Nick to take from here and tell the story.
Yeah, great. Thanks ever so much, Paul. And as you said, you'd reached out and the mayor had reached out to see whether this was something that was valuable for him to participate in. So we're just really thankful and really appreciative of the mayor's willingness to be part of the Mayor's Alliance to end childhood hunger. I mean, we think this is an incredibly important initiative and provides a lot of opportunities to not only just raise attention to the issues of childhood hunger, but also more importantly, to look at ways of dealing and addressing this. And this is both from a resource perspective, but also just raising awareness and creating the necessary connections to where the support and opportunities exist to be able to address some of the challenges. And again, part of this is also advocating for some of those programs, those important programs that are already in existence to help create the necessary access to food for our children in their schools. And when we say children as well, this is also by extension their families as well. And this is during sort of the school term, but also importantly during those times of the year where children are not at school and don't necessarily have the access to some of these programs during the summer, for example. I mean, so there, as I said, there is a lot of opportunities, and sometimes those opportunities need to be connected, and there needs to be awareness to where they are and also how to access them. And I think just looking at the White House challenge to end hunger that you just presented there, Paul, I mean, as from that you can see, I think there is a lot of opportunities, but sometimes it's the necessity to create the connections and the convening that's important as well. And as you can see here, some of those areas of support around SNAP access, the Farm Bill, the Healthy School Meals for All, Federal Child Nutrition Reauthorization, summer meals, and the expansion of community eligibility. A lot of programs and a lot of resources, and it's important to have the mayor's support behind that, along with all the other mayors. I think we all know that ensuring children have access to nutritious meals throughout the day has an incredibly important impact on their ability to learn. There's a lot of research out there that provides that important insight into the connection between healthy meals, being food secure, and the positive educational impact that can have. I think importantly, it's sometimes to look at it also from a perspective of where we talk about access to textbooks and other resources like computers and transportation. I think we should think about meals and the access to food as being just as important a component as ensuring that a child is able to get the best out of the education opportunities that are presented to them. So access to food and access to healthy food, nutritious food, is just as important as everything else that goes into ensuring a quality education. In Charleston County, the child food insecurity rate is 9%. So that means that over 7,000 children who are in the Charleston County don't have sufficient food every day to live that healthy and active and productive life, which again, as I said before, is obviously going to impact their ability to learn at school, their wellness, and also importantly, their behavior, their presence in school as well. And I think we need to look at this from a perspective also as an investment into the future, an investment into the child's future as they move into adulthood, and being able to prepare them for the best future possible. And obviously food security is a key component of that. So just to run through very quickly, just to give us a quick overview, Paul thought this was important just to give a quick snapshot of some of the programs that we're doing to look at helping address childhood hunger. Bearing in mind that we do this in collaboration and partnership with many, many different partners throughout our service area, and importantly with schools, with parents as well. First one is Kids Cafe. This is our providing after school meals to children who would not necessarily have access to meals at home. So therefore, during after school activities, they are able to access a healthy meal that's provided through our production kitchen, and that's supported by the CACFP program, which is USDA administered program that's working here in South Carolina through DSS. Backpack Buddies, I'm sure many of you have heard about Backpack Buddies. I mean, this is a program that's quite a foundational program for us and is implemented in many different places around the country. But this is instituted in partnership with schools where we are providing where schools provide very discreetly pre-packed child-friendly bags of easy to open, easy to eat food to take home for the weekend. We find that not only is this something that children eat, but obviously sometimes this also provides food for the family as well. But providing that food at the weekend for children is also lessening the burden on families in freeing up resources that would otherwise have been used to buy food, that be able to provide other necessary needs during that weekend as well. So Backpack Buddies is a very popular program. School pantries and school markets. These are working with schools in partnership with schools to provide access to food. First of all, the school pantry. The school pantry is a box of shelf-stable food that's pre-packed and available for both students, but also family members as well to have access to. The school market is an extension of that. This is in schools where we set up a market style access to food in an area in the school that's designated by the school, where children and parents can shop. They can shop in a dignified way. They can have access to a whole range of foods that they need, which doesn't just include shelf-stable food, but also includes fresh produce, meat, and dairy as well. Again, done in a very dignified way, and it's a shopping experience like any of us would experience if we walked into a shop. Summer meals. So again, as I said before, during the summer, this is often a time when children don't have access to the same nutritious food as they have during the school time. So we provide, working with our partners, with day camps and parks and recreation departments, to provide breakfast and lunch meals to children who are attending these summer school programs. Again, sometimes this is one of the most important meals that children get during the course of the summer. Fresh for Kids. This is where we are providing fresh fruits and vegetables to children at schools. This is something that is done as more of a pop-up opportunity. And again, it's trying to focus very much on issues of nutrition and health, and introducing those fresh fruits and vegetables to children and their parents to choose and take home whatever they like. And it's often very seasonal, and sometimes it's also being able to access food that would otherwise be very expensive if you had to purchase it through our retail stores. And then just finally, we have a big nutrition team here that's focusing very much on our nutrition education in terms of raising awareness to issues of nutrition, the quality of food and the importance of that. Here in South Carolina, we receive support through the SNAP Education. We're an implementing agency. The goal of the SNAP-Ed nutrition program is to ensure that we're able to support individuals and families that live on a limited budget, both in terms of the preparation, selecting and eating of meals that provide the adequate access to nutrition. We have a Cooking Matters curriculum that's a nutrition education, our nutrition education team administers. It's a 6-week cooking class that we do with children, with kids in schools. It's not just about cooking, it's the whole range of education and understanding. It's done in a fun and creative way. We use different tools and approaches to make it fun for our children in those lessons. It also importantly creates not just an awareness to nutrition, but also provides important life skills as well, and the idea of choice and the importance of nutrition and the value of nutrition. So our children really love those cooking classes that as well. So I'll stop there, but that was Paul thought it would be important just to give an update on the Mayor's Alliance to End Childhood Hunger, but also related to that, some of the work that we do that's aligned very much with that. And we're incredibly grateful to the Mayor and his support that he's providing to both the Alliance, but also the work that we do here as well.
Thank you, Nick. Appreciate that. Any questions on this?
Kevin, I didn't know whether we wanted to support this, do the motion that we support the White House challenge and the mayor's. I just think it would be nice to have it come out that we as a community support what Nick's doing, but also it's going to be a voice for the WIC program to make sure we're getting out the information that needs to be out there to try to end this hunger issue.
Very good. Can someone give me a motion to approve to support this program?
I motion to approve and support.
A motion to approve, a second, please.
I second.
Okay, we have a motion to approve and a second. Any further discussion on this? All in favor, please say aye.
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 Any
Aye.
opposed? The ayes have it. Thank you. We will pass that along to City Council and let them know that we are in favor of moving forward with this. So thank you. All right, and Nick, while we're on this, I think that Sunday, this coming Sunday, I think you have the Low Country Food Bank Walk for Water. I'm sorry, Walk for Hunger at Wanamaker Park. Is that correct? And tell us a little bit about that.
Absolutely. Thank you very much for reminding us all of that as well. Yeah. So this Sunday, the Walk to Fight Hunger, it's at Wanamaker Park in North Charleston. It starts at 11 to 2 p.m. The walk itself starts at 12 p.m. We've had a great sign up for that. I mean, we have probably over 200 people signed up for that so far. And on the day, I know we will have a lot more as well. So we're expecting a huge turnout for that. It's a fun day. There'll be a lot of activities there. And again, it's to show up and again, related to what we've just been talking about, show our support to issues of hunger and our fight against hunger and ensuring that no one in our community finds themselves in a situation of going hungry. So thank you very much for raising that. So yeah, this Sunday, the walk starts at 12 o'clock at the Wanamaker Park. So thank you very much, Councilman Shirley.
Great, thank you very much. All right, well, we'll move on to our community health update, and I see that Dr. Katie Richardson is on with us now. If you'll take it from here, thank you.
Thanks, Councilman Shealy. Good morning, everyone. I have a lot of information, so I'm going to just sort of give a few highlights, and then I'm happy to take any questions. I want to start with COVID. Many of you probably know from your own communities that our COVID cases are beginning to rise again. Not only are cases beginning to rise, but so are hospitalizations. Deaths, thankfully, are still low, but are beginning to increase as well. So we are thankful that the tests that we have, the at-home tests, are still effective in diagnosing the COVID infection. The Paxlovid, the antiviral that we have for treating COVID, is still effective against the new variants. So we do continue to recommend Paxlovid for those 65 and over and with other health conditions. It is important to take it early. So the recommendation is to test early and then seek out Paxlovid with your provider if you are at higher risk for complications. Masking is certainly still a good option for preventing transmission of COVID for those who may be ill and for those who are at risk and for those who are close with someone that is at risk, either in your household, in your family, or in your community. There is a new booster on the horizon. We are still waiting for FDA approval of that booster. We do believe it will be more effective against the new variants. There is still the current bivalent booster available for anyone who has not received that booster and feels that they need protection right now. For those, however, that don't fit that category, my recommendation is to wait for this new booster that I think will be more effective. And as far as the timing of that booster, I think it really depends on, the risk that the person has for severe consequences of COVID. If that risk is high, my recommendation is get in line as soon as it is available. For those that aren't in those high risk categories, we may think about when do we most want protection. And if that is around the holidays, for some people, waiting until, for instance, near the beginning of November for that COVID booster may make more sense. I think I'll stop there with COVID. We do have flu vaccines available now, and we are starting to see flu cases begin to rise. So I do recommend beginning to think about getting that that flu vaccine at a pharmacy or at your provider. There's nothing special about flu shots this year. It is a new updated formula, which is the case most years. There is a high dose formulation for those that are older, but everyone 6 months and older is recommended to get a flu vaccine. And I do recommend getting that sometime this month or in the first part of October. And there is a recommendation that it's fine to get the flu vaccine and the COVID vaccine together. There's yet one more vaccine on the horizon, not even on the horizon, it's here, and that's for RSV, or respiratory syncytial virus. There are several formulations of that. Two are for those ages 60 and over. It is not a blanket recommendation for everyone to get that, but rather talk to your provider about whether it makes sense to be protected against respiratory syncytial virus this year, or whether you might want to wait and see what the season holds, and whether it makes the most sense for you now. There's also an RSV. It's actually an antibody treatment, but it's very similar to a vaccine. It's given as an injection, like a vaccine, for infants up to age 8 months. And that is recommended for all infants to prevent respiratory syncytial virus. It's really most dangerous for those who are very young, as well as those who are older. And finally, there's now a maternal vaccine for RSV, but that's still awaiting sort of the CDC recommendations. It's been approved, but not yet recommended for specific groups. So we're still waiting on that final sort of step in that vaccine rollout. So quite a bit about respiratory viruses happening now. So we remember from last year, we had an early flu season. RSV was a significant issue in our communities, and COVID certainly was as well. So we want to be prepared, and that's vaccines as well as our other preventive measures of staying home when sick, and hand hygiene, masking when needed, and testing. And then finally, I want to end with a few SHAPE, or sexual health awareness, STI prevention, and education initiative activities. Pride Week is this coming week, the 10th through the 17th, and then PrEP Awareness Week. So PrEP is a antiviral medication to prevent HIV infection, and so Awareness Week for that is the 25th through the 29th. There will be speakers every day at lunch, and I'll ask Paul to send out that schedules, as well as how to register. There's also free testing at College of Charleston, as well as at DHEC clinics for all sexually transmitted infections at DHEC clinics for HIV at College of Charleston on the 28th. And I think I'll stop there and take any questions that anyone has. And obviously, you're welcome to reach out outside of this meeting as well.
Thank you very much, Dr. Richardson. We'll call on Paul Peters.
Paxlovid. Every time you get COVID, you need to take Paxlovid.
Yes, for those at risk. So it's not for everyone, but it is for those who are ages 60, 65 and over, as well as with any risk factor that might make you at higher risk for severe consequences. So other medical conditions. And as I said, it's important to take it early and it is something, therefore, my recommendation is test early and talk to your provider about Paxlovid. All right.
Any other questions? I do see that Kimbo put on there that he had to leave. So, go ahead, Paul. I'm sorry.
I think Katie's still smiling because Duke beat Clemson, so I'll give her the credit.
It was quite a game.
All right. Well, thank you again. Appreciate that very thorough update. And if there's no other questions, we'll move on to our community health and wellness updates. Jennifer Brush, you have anything you want to update us on?
I do. Good morning, everyone. I just wanted to share that September is National Suicide Prevention Awareness Month. And just give you some updates on our 988 new center that we opened at Charleston, Dorchester Mental Health. So we've answered more than 1,300 calls at this point. But I'd like to send, Paul, I'll send you some flyers and different things. We have LGBTQ lines and veterans lines and chat lines, and just so that this group can share it with everybody with a lot of resources. Because we have 988, we have mobile crisis. There's Department of Mental Health has 2 screeners that you can do online. One's for adults, and we just rolled out, I think we rolled it out, a screener for kids. And a counselor will call you back, and if you have a need to talk to somebody. And I do have I'll just end. I know we don't have much time. I'll end with some good news. We're always, suicide data is always kind of a year or two behind, but in the US saw a 3.6% increase in suicide deaths from 2020 to 2021, but South Carolina saw a 9.6% rate decrease from 20 to 21. So we are a zero suicide state, and we have lots of programs and lots of trainings and things. And really it's all about, knowing who to call and sharing resources with people. And if you see someone that needs help them get the help. So I will send you all a slew of information later today. Paul, send it. If you could just share it with everybody, that would be wonderful. And that's all I got. Thank you.
Great. Thank you. Maggie Dangerfield, I know everything's full go at Charleston County Schools now. Everybody's back in and moving. If you would like to give us an update.
Sure, absolutely. Thanks for the opportunity. Yes, we're super excited. We welcomed our students back on the 23rd, and we are slowly getting in the routine after a little e-learning last week with the hurricane and the holiday on Monday. But we're really excited for this year. On the health and wellness front, talking about COVID, our nursing services is no longer conducting positive case investigations, but they're following guidance by DHEC. If someone reports they've tested positive, then they should isolate for 5 days from onset of symptoms, and they can return to school or work on day 6 if they have been fever-free for 24 hours or prior. Currently, we don't have a mask requirement. And of course, if we see certain trends, particularly of a certain threshold in a classroom or more, then, that would be shared with administration to make further determinations. And of course, our schools all have the Purple and Teleswab COVID-19 kits available for staff and families. And so we encourage those looking for that resource to please utilize that as well. On the non-wellness and health front, we have a couple of exciting things going on this fall. One is we welcome the new superintendent this summer, Dr. Gallion, and he is embarking on his 100-day engagement plan. And so as a part of that, in addition to meeting with leaders and community organizations and just a cross body of stakeholders in the community, he's also holding town halls in each of our what we call constituent district areas, so different geographic areas of the county. And so we'll be sharing the list of those and the dates and locations and times, hopefully today, if not today, tomorrow. And we encourage everybody to come out and meet him. And he's really dedicated and committed to listening and learning. So we're really excited about those opportunities. Also, right now we have our academic calendar survey out for the 2024-2025 school year. Really exciting. There's 4 options. Some of them are what you typically see each year. And then there's a couple that are a pretty significant departure from what we are used to. So there's some great resources on our website, ccsdschools.com/academic calendar. The survey link is there in English and Spanish, as well as all 4 calendar options that we're currently surveying the public about, and a calendar comparison document to help you navigate through the changes of what each of those look like. So we really encourage absolutely everybody in the community to weigh in, as we know this significantly impacts things, particularly if a different calendar option was selected ultimately by our board that may change the length of summer break or the number of breaks we have during the year, and knowing how much our community comes together to support students when they are not in school, and kind of what that would look like just from a whole community aspect. So certainly if you have any questions, please reach out to our office. You can email us at communications@charleston.k12.se.us or give us a call. Our number's on our website. So those are kind of the big things going on right now. But we are excited to get into the swing of things.
Great. Thank you so much. Appreciate that. Joey Kern, anything from Trident United Way?
Just to mention that if folks do want to get more involved in this work around transportation, food insecurity, and access to healthcare options, that they can get in touch with us to join our Healthy Tri-County Coalition, which is a joint effort between Trident United Way, MUSC, and Roper St. Francis. And we have lots of great folks in that coalition, including the Low Country Food Bank and many others who are on this call. So if other folks are not a part of that group and would like to get involved, let us know and we can get you in and start attending those meetings.
Great, thank you. Did I miss anybody that wants to give an update? Any updates? I did want to mention that Sunday, September 24th is the Cooper River Bridge Run Kids Run. It'll be at Stony Field from 2 o'clock to 6 o'clock. So if you have any kids that are interested, I know Paul would be happy to have them out there. So if you'd like to participate in that, again, it's Sunday, September 24th, 2 to 6 at Stony Field downtown. So also wanted to mention that the St. Andrews Rotary Club is helping out with the Miracle League. The Miracle League is still going on over off of Forest Park. If anybody would like to help out, would like to be a buddy to some of these kids that are participating in it, or would like to announce or do anything like that, we'd be glad to have you. But it is continuing on weekends now. So I think it starts at 8:45 and runs till about 2 o'clock in the afternoon. Starts 8:45 in the morning, so and runs till 2 o'clock. All right, anything else that needs to come before this committee? Any other updates? Well, I appreciate everybody's time. I know it's a short week. We went over just a few minutes, but we were able to get a lot of information in. It was a great meeting, and I can't tell you how valuable you are to the city of Charleston by serving on this committee, and we very much appreciate it. So if there's nothing else to come before this committee, we are adjourned. Thank you.
Thank you.